So today we are focusing on the designing with brackets planning team, either folks who are reflecting on how you've designed it or you are projecting on how you will design it. And then in December, we've mapped out kind of acupuncture points for what this journey of this year can feel like together. Needs assessments, asset maps. In February, we'll come together to talk about what are some challenges and dilemmas. And then in April, we'll actually be sharing out what we're thinking about for the preliminary screening plan with each other and getting feedback. I want to note, always, 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 each of you are at a different point in your grant work, in your community work, in your own skill set, in your team's formation. So we're going to embrace where you are as exactly where you are, meaning we don't need to compare ourselves with each other. We can support each other in where we're learning and how we're learning. So I just want to make sure that everyone, there's no like panic, oh, we're not there right now, or oh, I need to be somewhere else. We're just going to embrace exactly where we are in this moment, and then either be peer coachers or also be peer askers. Again, we're going to deeper dive into our teaching around, again, bracket designing a planning team, either reflecting on how we got there in our design or projecting on how we want to in the future. I'm really grateful, really grateful that Dr. Moore is joining us this morning. Stephanie has been working with the commission for a long time in supporting the universal screening framework, policy and practice for CBH, and is also on our steering committee for STAC. But I think the most important line that I want to welcome Stephanie to is, Stephanie, I've just so been moved by your ability to be micro and macro as both a researcher, professor, but also a practitioner. And so thank you so much for being here. Stephanie's going to walk us through both a kind of combo of implementation science driven research and best practices for designing either in reflection of how we got there or projection of how we will. Designing a planning team. We are recording this and we'll be posting it on the hub. So we really welcome you to glean and marinate, and there'll be many, many moments along the teach-in for us to share how we're experiencing the teaching, how we're, what we agree with, what we aspire to, what we might argue with in the real life. So I'm going to hand it to Stephanie.
Thank you. And thanks everyone just for having me in this space with you all and being able to be here and just share in our collective learning. I recognize I'm sort of leading this moment, but I also want to call everyone in as we're talking about, different things, over the next 30 minutes or so. If you have questions, if you have insights and you want to share them, please do. You can drop them in the chat, you can unmute. Like, this is a space for us all to learn together. And so I really want to lean into that with you all today. And as we have talked about multiple times already today, like, I know, right, that we are all coming to this space with a range of different previous experiences, knowledge bases, lessons that we have learned or that we are teaching others, right, in relation to the larger scope of the work that we're doing, but then also like the very specific scope of work, right, that we're here to talk about, which is thinking about universal screening in our school context and how that relates to our school mental health systems. And I hope that we'll be able to leverage and think about all of those different pieces of expertise and background that you're bringing with us today. This slide that you're seeing here is a little bit of a condensed version of some of the steps that myself and some colleagues who I just really respect and admire, we collaborated to create this roadmap of sort of processes for designing, developing, and reflecting on an equitable school mental health screening process. I said I sort of adapted because I shortened some of the later steps, right? Because I know we're at different spaces, we're at different phases, I'll say, in this process in this space, but I want to kind of hone us in on some of the key designing pieces, right? Really designing a planning team today, but also thinking about designing a universal screening process. And so in brief, in this paper, right, we outlined in green here, right, some of the steps that we want to think about, critical processes that are important for what we're doing before we're even collecting any data from people whatsoever, right? These are things that are really important for us to sit with and spend time around, right? And to think critically about. And I know that many of you all, right, are engaged in various ways in this work already and right now. In blue, right, we're thinking more about like actual implementation processes. What are the steps or considerations that we might be engaging with as we're moving toward collecting data from actual students or teachers, to then what are we doing with the data in sort of purple. I'll say though, these are kind of, we delineated them right into sort of 3 steps: before screening, during screening, after screening. But there's 2 key things here. One, this is meant to be an iterative process, right? Any good implementation effort, we are continuously improving, right? We are thinking about, this is where we are maybe right now, this is where we've been, but how can we learn from where we've been and where we are to really continuously refine and improve our processes? So one, this is iterative. It's a roadmap, but like, we might be backtracking on our road trip, right? And like going back to some of our favorite places or places we didn't spend enough time in and trying to enhance those processes. So that's one. The other piece is that equity is the core of this work, right? We're really thinking about how are we doing this screening process in a way that is going to be supportive of all students in our school communities, and especially students who may not otherwise be identified, right? So in this work, we're really thinking about fundamentals of sort of systems, right? Systematic processes, how screening and school mental health systems intersect with other systems in our schools and communities, and thinking about using our screening data in a way, right, that uplifts some of the things I've already heard you all talking about this morning, right? Community and family and student voice, right? Or thinking about partnerships as being a foundation, right, of doing this work really well. So with that really high level overview, I know we had invited you all to take a look at our paper prior to coming to today's session. I recognize though that there is a lot going on in all of our lives. And so I just want to give a moment to pause. And for any folks who have had a chance to look at the paper, or even just as you reflect on the sort of processes or considerations that are outlined on this slide, what's an insight that's coming to mind for you about this universal screening process, or what's a question that you're sitting with in relation to designing and planning equitable universal screening processes? And you can say that out loud if you want, but I would invite you just to put that in the chat, right? Either an inquiry, something that's coming up for you, an insight about your process, or a question that you're sitting with as you navigate wherever you are in this work. So that'll be the first question I ask you to do in the chat, and then I'll ask another in a moment.
Dr. Moore, I think Mara shared from San Diego. Also, thank you for engaging on the hub, but you shared an insight and an inquiry in the chat as well.
I just cut and paste my homework, so I just copied from the hub what I put in there.
Oh, excellent. Thank you. Yes, I missed that earlier in the chat. Yeah. So thinking about, yeah, there is no universal approach, right? What are we thinking about our local community, and how are we designing an approach that's fitting our needs, our folks, right? What matters to us. Thank you. Yeah, Melissa, taking a trip backwards, we're visiting some of our stops. Excellent. Excellent. Great. And so I'll invite those of you who haven't shared in the chat yet just to think about as we talk today, right? What's coming up for you? And we'll invite you as well to kind of revisit potentially what's in this paper as well, as you kind of continue through this learning space together. What I'll ask you to do now, right, as you can see, right, I'm not going to do the count out loud, but there's a collective of steps here, right, that are sort of in this roadmap process. And I want to lift up that we all in this room are maybe in different spaces in our counties with this work, right? And so I would invite you now to try and place yourself somewhere on this roadmap, right? Where are you in your county in this work? And you might be at multiple places, and you can put in multiple places, but sort of where are you at right now in this work? Drop that in the chat so we can get a sense of where we all are coming into this space. Multiple spaces, yeah. Clarifying goals and objectives, great.
I think San Diego is in a unique position because with our other BHSSA grant, that we have been doing years of resource mapping with our districts and our charters. And we developed a pretty comprehensive resource mapping referral pathway project. And so we feel really fortunate because we, through our annual needs assessment and we're able to kind of do a gap analysis and create a customized resource map for each LEA. Because our county office has put together a county-wide resource map for every mental health tiered support. So if we're working with the district and they're like eating disorders, we don't have anything for tier 2, we're like, we have all these resources and services we can fill into their map. So we feel like because we've laid the foundation for that work, we're at an advantage in this process, because that's timely, intensive work to do the resource mapping. So it'll be interesting to see how that all kind of aligns with our planning team and the needs assessment we're doing for this grant going forward.
Yeah, wonderful. Thank you for sharing that. And love the connection between sort of multiple pieces of this process, just in your description of what's going on with resource mapping, right? And thinking about kind of the multi-leveled nature of that, but also how that resource mapping process is really setting the foundation for the what comes next, right? We're thinking about systems design and how we're going to use those data. So thank you. Yeah, that's really wonderful. I'm seeing some others sharing in the chat as well. Really, yes, we're all at sort of very different phases, right? Some working on sort of doing that ecological assessment, expanding the team, building out the team, thinking about partners, inviting those partners, and engaging, again, some other folks as well in sort of that resource mapping and clarifying goals and objectives. Wonderful. So thank you for sharing that with us. And I want to emphasize, like, this is not a judgment space. How far along are we in this process? But it's really so we can, again, learn from and with each other, recognizing that we're coming to this space, having engaged in different parts of this work already, and have insights or questions we can share with each other around that work. So I want to take us like real fundamental for a moment and thinking about teams, right? And recognizing that some of you may already be like, you're jamming with your team, right? Whereas others are thinking about, we're building this team, we're trying to figure out who's going to be on that team. At its most basic level, right? A team is just a group of people, right? Who are brought together for some sort of shared purpose or activity, right? In this space, we're bringing teams together to think about planning for universal screening, right? But functionally, what these group of people do, right, is they meet together and they communicate regularly. And ideally, we have systems in place for different types of communication amongst our team members as we're working toward, right, that shared purpose or activity. That team in function, right, is ideally going to be using some sort of information, some data to support their decision-making and their action planning, right, toward that sort of shared purpose or activity. And a key piece here that I think about when it comes to teams and what I've heard and learned from folks about what makes their teams really effective is that folks on that team have a sense of a shared vision and mission for their work, right? They have taken time to establish that for themselves. Sometimes we assume, right, we're coming into a space, maybe we all do some kind of mental health, behavioral health, education work. We're on the same page, but there can be a lot of subtlety and nuance, right, in what we bring to that space. And sometimes miscommunications or misunderstandings if we're not clarifying what is that shared purpose and vision here, right? I gave an example very broadly on the slide just about, you know, that shared vision for mental health and well-being, but what does that look like specifically for your team? Right, harking back to some of the comments in the chat, how is that shared vision and mission also informed by our local priorities, right? Our community, our partners, right? How are we informing that in community with the folks around us, right? And so having this, again, very basic understanding of our team purposes, I think can help us to think through how we design that team and who is on that team and the work that we do, right? As we continue to strengthen maybe those processes of our teams that already exist, or how we build up, right, those teams that are kind of being formed in this moment. So thinking about who's on that team, and I love that I've already heard in some conversations today that we need to be a bit of systems thinkers when it comes to doing this work, especially as part of this initiative, right, this grant initiative, right, because we're thinking about lots of systems, right, and we're working we're here with county representatives, right? But we're in a complex ecosystem when it comes to supporting mental health and well-being in our state, a lovely ecosystem, but it's complex, right? We've got lots of players and folks working in California. My little Venn diagram does not do justice to that complexity, right? But we might think about an education sphere of folks working on health and well-being, health and human services, which might include behavioral health, child welfare, right? Public health. We've got our justice, and sort of juvenile justice agencies and how they're supporting youth mental health as well. But even if we just look kind of across these systems, we have the intersection at different sort of levels of our ecosystem. We're thinking about counties, we're thinking about our districts, if we're talking about schools, and we're thinking about a specific school context in our educational settings, right? And I found, I nerded out a bit on this slide, I found a tool to make a map with like layers. I couldn't get it to label, like I wasn't that advanced in doing this work, but what I really loved about being able to vision this, and it's a little hard to see, but the darker lines are the county outlines here, and the lighter blue lines are districts within those counties. And I wanted us to take a moment to look at this because I know, again, many of you are thinking about who are our district partners, how are we forming those partnerships? And there's a lot of variability, even looking across the counties in our state in terms of the numbers of districts, the size of those districts, in terms of enrollment, but also geographic size, right? And so in this work, we really have to be mindful about not only thinking about who's within our system, right? If I'm coming from county behavioral health or a county office of education, who's in my system who might be on my team, right? But then also who is in the systems that we're going to be interacting with, right? Whether that's a local school district or specific school partners, and how are we thinking about our teaming in terms of an internal system way, but then also a cross system way, right? Within my folks, but then also with the folks we're hoping to partner with, and being dimensional. We may need to work toward multi-team structures, right? We have a design team, but how is that design team interfacing with other existing teams, right? That might be operating around a similar shared mission or vision in our school context, right? And so this is my pause to reflect on that complexity, right? And how we are navigating our teaming processes around that complexity, right? So hold on to that nugget. In a moment, I'm going to ask you all to kind of reflect on where you're at in that process. But before I do that, I want to seed us with a little bit of more information around that complexity. So first, this is likely information y'all already know, right? But I want to get us in the same mind space. When we're thinking about general roles and responsibilities when it comes to doing universal screening work, these might be shared by multiple teams, right? We're thinking about what is our why, right? Aligned with that shared mission and vision. What is the need for doing this universal screening process? What are our goals or our objectives, right? Generally across teams, we're thinking about securing buy-in from those key partners, right? Lifting up our families, our staff, and our leaders and our young people, right, in this work, and thinking about how what we're doing is meeting their needs and lifting up the values and priorities that they have, right? We're engaging in systems building and refining, right? We're planning for responding to any data we may eventually collect. We're thinking about, again, engagement with and communication with families, developing partnerships, coordination, etc., right? This can span across all teams in our system. We might have varied roles, right? Or varied, I want to say foci, right? In that process, right? More macro versus more micro in that work. But we all might be engaged in these similar processes, and how do we coordinate? But we might also have some distinct processes that we're engaging in. That might look a little bit different if we're thinking about a county level team, a district level team, or a school level team. I won't read all these aloud to you, but I want to invite you to take a moment to look at some of the different potential priorities or responsibilities that we might align with sort of a more micro, right, kind of school team versus a more macro focused, perhaps district or county team who's thinking about multiple districts, multiple schools, right, that they might be working with or thinking about partnering with in this work. And what I'm hoping you'll notice here, right, is that our sort of more macro level teams, our county or our district teams, might be thinking bigger picture, right? Some of this vision, some of this mission, but they're also thinking about how are we equipping and building capacity of our district or school partners to be able to do the work, right? And critically, right, if we're thinking about this team design process, I'd encourage us to reflect on how is the team that we're designing or have designed able to interface, right, with teams at these levels, right, other levels in the system? How are we supporting cross-team or cross-system collaboration and communication in these processes, right? And as Lyra added in the chat, I'll invite you all also to think about, are there other roles and responsibilities that you know of or have experienced that you think are relevant in this work? Thinking about maybe your county level teams that you're thinking about right now, or how you're interfacing with other teams. Let's get a quick, did someone unmute? Sorry, I'm gonna pause.
Oh,
Thank you.
Sorry, I was just gonna say, again, with our other BHSSA grant, this is our model. So in our county, we chose to do a capacity building grant with the Mental Health Student Services Act funding. And Rachel and I were just going, well, this is our model for how we're doing it for our other grant. And so it's good to know. We're layering on the universal screening grant in the same fashion, right, as you have up here. So there's a lot of alignment, which is nice to see.
Yeah. So I'm loving that, some validation, but I also just love the word that you used, alignment, and thinking about that alignment between what we're doing in our county and how that's connecting, right, with our districts or our schools that we're partnering with. I love that. Yeah. Joey in the chat, thank you. Yeah, right. Another thing we're thinking about, one of our, specific roles or responsibilities is how are we meeting folks where they're at, right? And really listening to where they're coming from, what they need from us, how we can support them. Super critical in this work. Right? Oh, I'd love to hear more about that work happening in Placer County. If we can put you on the spot, thinking about your work in the cascading model support.
Patty or Joey, I take this.
I was gonna try to pass the ball to you, Carrie. Yeah, I can take it. Looking at, so it was actually Stephanie, the first slide that you were talking about, the roadmap, really resonated because there's a lot of we realized that and Patty was a really big, Patty and many others were a big proponent of helping us find this vision of really trying to help start coaching at the district level and then down into the sites instead of site level only. And so we have ventured into building a cohort for a district community leadership team, and people are showing up and they're getting it done. And so the idea of identifying that team to really be able to make decisions. Because I think the other part we were butting up against a lot is we would have these, we'd have really good trainings. We would meet with great teams, but no one had the power in the room to make changes, either financially, job description, policy, etc. And so really bringing the work to them, and that's a whole different level of work too, right? And so being able to like I said in my chat, is really listen a lot, and I know it's a very cliche thing to say, but meeting them where they're at. And so whether that is informing, educating, co-designing, and helping them realize kind of what's in front of them too. I hope, Christine, I hope that is what you were hoping that I would say. And if you want to prompt me to bring up anything else, let me know.
You're amazing, Joey. Thank you for taking the bait on that and speaking up. And I fully called you all out. Just proud of PCOE and all the work that we've done through the Cascade and serving as the county level as that liaison between the state and the districts, and then down to the school teams as well. And I think we've done a lovely job of that through PBIS and can leverage a lot of that learning and that mastery in this work now through universal screening as well.
Absolutely. Absolutely. Yeah. Thank you for sharing. And I think I'll use this as a bit of a segue to a reflection question for us all, right? Some of what's been coming up that I'm hearing just in what folks are sharing so far is you're thinking about a little bit about who, right? Who are we connecting with in doing this work? what is already existing. Joe, you mentioned kind of bringing the work to folks, right? And so I'm thinking about, if you all could reflect on, again, you can share in the chat, you can unmute, what existing county district or school teams or systems are you engaging or can you engage as you're planning for this work, right? And how did you come to know that these are the folks to reach out to, or you think these are the folks to reach out to?
I can speak to that more so in the way of a question than having an answer. Just sharing our process of universal screening, which I shared with our small group, is a parallel process where we've had a universal screener in place for several years prior to me being in my position. And that screener is being used by multiple schools. And there are several schools within our county that are not using a screener. So we're at the beginning stages of planning a team that's appropriate for schools that don't want to use the screener that we are offering. And some of the schools that are utilizing that screener, we need to go back in the roadmap and to see, is this really effective, and what's the purpose, and what school community is benefiting from this, or are we not looking at all of those pieces? So there's multiple parts of, I guess, questions that arise for me in the process of the universal screener, from seeing it in action, full action, and people using it with fidelity, to having data driven targeted interventions based off of the data that we get from our screening platform, to schools saying we can't use such a robust process and we would like to have some more buy-in from staff and possibly even create our own screener. So we're all over the board, and it's not offering an answer, but more of many questions to ponder on.
Yeah, thank you for sharing that. And sitting with those questions, and I'll invite others too in this space. If you're hearing, right, what your colleagues are sharing, like, I welcome you to also respond and chime in, and what's coming up for you, right, as you're hearing these questions or this reflection. But I think, some of what's resonating for me and what you were sharing is there might be different folks within our larger county that we might need to partner with in different ways to be able to think about meeting whatever that shared vision and mission is in this work, right? And recognizing that might look differently for different partners in our county. It adds a whole other layer of complexity. And so how do we navigate that and reflect on that, right? What I'm hearing come up too from your reflection is really this intentionality, and not to go back to sort of, the cliche, Joey, but I love it, right? Around how do we meet folks with where they're at, right? And connect with them around what they want to know and how we can help guide them in this process, but also understand what they need out of this process. Yeah, thank you so much for sharing. Yeah. Any other reflections around kind of existing teams, systems that you're thinking about as you do this work? Leora, please.
I'm popping in. I raised my hand, I'm popping in. We talked a little bit about this in the Sunrising series, but I'm going to put on my community organizing hat for a moment and just also name that sometimes the move is to go with where we have strong partners, who are our champions. And then the other moment is actually to embrace folks who are completely anti-universal screening, never want to do this, are going to rail us at school board meetings as hard as they can, and really get to the not just the challengers, but not just the champions, but the challengers. And I wonder about this question, like, there's this word engage. Engage doesn't just mean like get folks who are on board. Engage also means get folks who are going to try and get us out of the Zoom room as soon as possible when we say universal screening. And I'd really welcome folks in chat to also share how you are skilling up to bring on folks who are really curious in a polite way of saying, curious about your vision for universal screening.
Yeah, thank you.
All right, I'll go for it. We encountered surprise community members when the grant award was being passed through our County Board of Supervisors to the County Office of Education. And to be fair, is sort of in the way that the project description was written in a brief synopsis for voting at the Board of Supervisors. And to be fair, it could have been interpreted like, unfortunately, it was to kind of say that we're coming in, the county office is coming in, and we're going to do universal screening for all students this year. Like it or not, that's what this grant was about. And so we had to do a little bit of cleanup, but call me naive, but I'm holding out hope that, you know, members of our community, they maybe have been misinformed about wellness as a whole. You know, we verge on the role of schools in that realm, all of that. And so we are choosing to lean in, and we're one of our first activities is to host a community book study on the anxious generation to just kind of get the conversation started. And that way, you know, 5 activities down the road on that roadmap, when or if it comes up, like you didn't even try to engage truly with your community and try and vet out some of those fears, or, you know, gosh, we're going to share our local data on, I believe Placer has one of the highest suicide rates in the state. And that's, you know, we have to lean into that. So that's the approach we're taking. So it feels a little bit slower here on the front end, but I imagine that it's going to pay off in leaps and bounds on the other side when we can be proud of the conversations that are going to come about as a result of that true community book study.
Yes. Yes, I love that. And I love coming together around shared, I don't know, I don't want to call it pop, but like the anxious generation is going around, right? I've heard lots of people talking about, and so I love capitalizing on sort of a community movement to have conversation, right? And to use that to learn with and from each other around those fears, those points of excitement, but also to just validate and appreciate and hear, right, where everyone is coming from in this work, right? And also thinking about us and how is this relevant to us and our needs in our county, right? Connecting those dots for folks can make it really, really helpful. Yeah. And I'm seeing others in the chat talking similarly around kind of thinking about some of those champions and challengers, right? And hearing different perspectives and really leaning into those different perspectives, right? If we want this to be eventually a real sustainable practice, you're right, Carrie, that leaning into this in the front end, right, is going to help us have a more robust and more sustainable team, but also system and process as we move forward, right? We've taken the time to get the range of different folks in our communities informed and on board. Absolutely. Absolutely. Yeah, prepping the soil. I love that. So I want to just plug, right? I imagine, and I saw some folks in the chat thinking about, Anna, you were sharing, right, kind of who's on your team, right? Those members of your team. And you'll likely see some of these similar types of sort of roles in our educational and county ecosystems, right? Represented in this list of roles here, right? As a sort of a friendly reminder, right? When we're thinking about our teams, we want them to reflect folks who have a range of experiences, being background experiences, lived experiences, professional experiences, and have those experiences be representative, right, of our communities, whether that's our county or our school district or our school, right? Thinking again about those cross-system representativeness. Those folks, though, can come with varied roles. And some of the research that I've done in our state, you know, I've heard from folks talking about their champions, right? And how sometimes the biggest champion for their school mental health or their screening work is the front office secretary, because she interfaces with students and families every day, right? And she knows what they're coming with and what is on their minds and what they're concerned about. And so I'd encourage you all to think about, how are we, right, connecting with those folks who, yes, are champions, but are also opinion leaders who are in the know and who might also push back, right? Because how are we representing, right, some of those challengers and thinking about who's on our team and what they look like. I want to come back to sort of skills and expertise in a bit of a concrete way, right? And thinking about, yes, our professional experiential skills and expertise, but then also as a design team, what are the things that we might want members of our team to be skilled in, right? And what different competencies might we want folks on that team to be able to bring with them, right? And what we've been talking about so far today, we're thinking about, yes, how are we building and or enriching, strengthening our effective design teams? But there's a skill in building teams, right? And thinking about who is on those teams and have we tapped into the people who are going to help us, right? I think it was Joey sharing earlier around, we were having folks in the room trying to think about decisions, but we didn't have like actual folks who could implement or mandate or lead those decisions, right? We didn't have policymakers or decision makers in the room. And that makes it harder for us, right, to kind of get the work in place and think about getting support and resources around that work. So we're thinking about who has skills and kind of knowing who those people are, putting those teams together, but also who on our team has skills in actually the process of making that change, right? Thinking about engaging with folks through that kind of maybe instruction in our initiative, thinking about coaching, facilitation. But we might also have folks on our team who are the real nitty gritty. I want to be in the data and think about, right, the outcomes of our team or the outcomes of our process, or thinking about our continual improvement processes. We might have others who have real strengths in those relational elements of our teaming work, right? Thinking about how are they skilled in building community, right? Engaging with folks, that guidance. Now, some of you may be a unicorn and possess all of these skills. I am not that unicorn. I don't have all of these skills, right? And so we're thinking about who are our colleagues in this work who can complement, right? Complement our assets, our strengths, the work that we're doing in order to really help us support that process, right? And so that's the question, right? And that's what I would invite folks to kind of, you know, before we move into a bit of a more in-depth discussion about this work, I want to invite you to reflect on that complementary aspect of your design team, right? Who is currently on your team? Who are you thinking about on your team? And how do you all complement one another, right? Sing your praises. What are the strengths that you have that you bring together? But also reflect a little bit on how did you all come together, right? What are the roles and processes and responsibilities of your team? Who is taking on maybe different aspects of those competencies? Are folks prepared and ready to do that work? Do they need to shore up some of their own knowledge and skills? Do we have space to actually work as a team, right? Are we actually dedicating time to our teaming processes, to being able to meet and communicate and discuss and sit with each other? And the question that I'll ask too, kind of related to Leora's point earlier around sort of champions and challengers, is do we have folks who will work together in this work? Can we work together and will we work together? That doesn't mean that we have to agree all the time or that we're always on the same page, but do we have folks who are committed, right, to being in process and doing this work together? And so I'll ask you, maybe before we move into this reflection, just to think about, sorry, I'll pull this piece up. Some of this, the main message I guess I want you to come away with is just how are we leading, right? We're leading in partnership and engagement. And so we want folks who have authority, but also influence in that space. We want folks who have expertise, but also experience in what we're doing. And then we're thinking creatively as a team about how we're engaging in our processes. How are we convening? How are we sharing and seeking perspectives? And I seek because our team, we want it to be representative, but we can't have every person feasibly on our team. And so if we notice there's gaps in our team, how are we intentionally seeking perspectives that aren't represented by the folks in our team, right? And then I want to lift up really the relational and the partnership driven nature of this work is how are we sharing leadership and responsibilities across our team in terms of the work that we're doing and recognizing the assets and strengths of the different members of our team in doing this work. I have I won't go down this tangent too long because I want to leave space for discussion, but I had a principal who I met with and talked with around universal screening work. And she was really big on thinking about the difference between adaptive and technical leadership. And how a lot of times folks in leadership roles, and not you all, right? But a lot of times, right, we might come across folks who are really just focused on the technical side, which is really important. How do we do this? What are the processes? I'm going to make this really clear and help you understand how to do this work. And that's valuable. But when technical leadership isn't matched with adaptive leadership, the relational, the connection, the engaging work, right? Sometimes we lose buy-in on the technical part, or we lose the real how to do that, right? You can give me information, but if you're not engaging with me around this process, right, it might be harder for me to feel engaged by the process, right? And to really want to do that work. So I want to lift that up for you all in this space too, thinking about how are we complementing each other, but how are the functions of our team complementing the work that we're wanting to engage in.